Today, in 2009, here in Kershaw County, we are experiencing double-digit unemployment. And with the double-digit unemployment in the backdrop of this beautiful town and having had wonderful growth because of DuPont and other textile industries, we now have individuals that no longer have jobs and have lost their health insurance.
Sandhills Medical Foundation is a community health center. It was founded in 1977 up in Chesterfield County, and it spread down here in 2002 and then down to Sumter 2004. Its purpose is to increase access to primary medical care for people in the communities that it serves. Toward that end, it gets a federal grant that helps cover some of its cost, that allows it to see people irrespective of their ability to pay.
One of our greatest concerns is that patients are coming to the emergency department for primary care. That's not the best home for these patients. We want the same level of care for everybody. And we want the people of Kershaw County to come to us for the things that we offer. But realizing that carrying out that mission can't be done without the physician providers, the healthcare providers. And we have our own private medical staff, just like all hospitals do. Have an excellent medical staff, very well-trained physicians in specialties that one would not likely find in a county like Kershaw County. But they can only take so much indigent care and keep their practice financially viable, especially in today's times. So if we have this mission of taking care of everybody, and we need the healthcare providers, and our private medical staff is doing its part but can't do it all, we have to look at other providers that might be able to help us carry out that mission.
I think Kershaw County Partnership is unique because we've been doing this informally for years. Having that, I think we have an advantage where we have a level of trust. We don't have to spend a lot of time trying to get to know each other. We don't battle over turf. We already know who's going to roll up their sleeves and do what, so we know who we can count on for what particular issue. And
I believe the greatest value in this partnership is that Sandhills Medical cannot in itself fulfill its mission. The mission is too big, the needs are too great. Also, other people see different facets of the problem, and by having other partners, a free clinic and a Kershaw Hospital, we're able to attack different angles of this and bring different assets to bear on the problem. My hope is that AccessHealth will serve as a catalyst to help transform the way the Kershaw Network takes care of indigent patients. Perhaps it'll help transform how it takes care of other patients too. The main goal is to transform how we coordinate care, how we share information, and how we manage these patients who have a tough time navigating the healthcare system as it is.
If I was given the opportunity to advise other healthcare systems about serving all patients, including those that don't have the ability to pay, I would first say, look at your mission. Is that truly what your mission is? And I would venture to say that's the mission of most hospitals. And then look at, well, what providers do we have to have in place in order to carry out that mission? Look at private medical staff, and then where there's a gap, seek to develop partnerships with free medical clinics or start free medical clinics if they don't exist. By having this network of providers through AccessHealth, that gives us the provider base to give them a primary care home, an appropriate primary care home, so that they can get good continuity of care. And so what it'll do, it'll draw us closer as providers as we strive to serve this community.
My advice to other communities would be to start talking. Go ahead and informally meet. Just bring everybody together on an issue of healthcare and see what everybody has to offer. And
be open about what their commitments are. Be open about what their mission is, and then look for common areas. It's a long process, but it's an essential one if we're going to be able to have a meaningful healthcare system.